Hi, I'm Ashley Georgakopoulos, the IBCLC and Lactation Director with Motif Medical. You asked some wonderful questions for baby's brew, so let's take some time to answer them. Flanges come in many sizes for a reason. We want to make sure we are using the correct size, even if it's a different size per breast, and even if you have some fluctuations in breast size. If that means making sure every once in a while to take some time to resize to get the best output and keep your comfort levels where they need to be, this not only ensures that we are getting a comfortable session, but it also ensures that we get the most possible volume output, which is always ideal. The answer to maintaining your supply is making sure that you are ensuring frequency and comfort at the breast, and also letting your body respond and react to the pump. This is going to be a little bit different than feeding a baby directly if they were to be feeding well. This does not mean that you cannot maintain a good and healthy supply for your baby. It just may mean taking extra steps to make sure that you're responding well to your pump and that everything is working comfortably and effectively. If you're using your pump often, if you're using it exclusively especially, make sure you're changing out valves and membranes at least every 4 to 6 weeks. This ensures that vacuum seal suction that allows us to get the most volume possible. There are many ways to collect and store your milk, especially when you're at work. And the beauty of breast milk is it stays very well refrigerated and at room temperature. This is why the pitcher method does work. A word of caution, you want to make sure that you're labeling correctly and not mixing from day to day. The answer is yes. However, they may not want to take cold milk. Room temperature milk or slightly warmed milk is probably most preferred, but many babies will drink milk straight out of the fridge. This can be for a couple of reasons. If you have a baby who is having a hard time staying latching or can have a hard time staying in a more rhythmic state when drinking milk, they may have a hard time at first with your letdown. Make sure that you are positioning correctly for optimal latching. This means making sure baby is facing you and not turning. And you want to make sure that the baby has a deep and comfortable latch. If they're popping or clicking or have milk dribbling down, you may want to make sure that they do not have a tongue or a lip tie, preventing them from securing a deep, more comfortable latch. With a good latch, they should be able to control the flow of milk even during a heavier letdown response. If you experience a heavier letdown and you feel like maybe you have an oversupply or having a hard time getting your baby to control that milk flow, try reclining back and letting your baby lay into the breast instead of the opposite way in which we're holding baby more upright and almost letting gravity work against them. Reclining back can actually help slow the flow and let them control it just a little easier. Your milk will not dry up if you're telling your body that the milk is needed. So whether you're feeding baby directly at the breast or you're exclusively pumping, frequency, comfortable latching, or comfortable pumping is going to be key. And by frequent, I mean not stretching things out to get less pump sessions in or less feeding sessions in. We need to be pumping as often as a baby would feed, which on average is every 2 to 3 hours, if not more often than that during cluster feeding stages. I hope these tips were helpful, and I thank you for submitting your wonderful questions because they're helping other moms too. Thank you for watching.